Hello, good morning, everybody, or evening. Again, si Dennis Latuno, and today, again, I'm gonna be discussing a different topic about adult asthma. So let's start. What is asthma? Asthma is a condition in which your airways narrow and swell and may produce extra mucus, and this can make your breathing difficult or trigger coughing or a whistling sound, uh, also known as wheezing, when you breathe in and out. And of course, it causes shortness of breath. For some people, asthma is a minor problem, but for others, it can be a major one that can interfere with your daily chores and lead to a life-threatening condition. Asthma cannot be cured, but symptoms can be controlled. Because asthma often changes over time, it is important that you work with your doctor to track your signs and symptoms and adjust your treatment as needed. Again, there's three major signs of asthma. Is the airway blockage. If you see the diagram, this is a normal bronchiole, an open or patent bronchiole, but when you have asthma, there's tightening of the air of the muscle band around your bronchioles, and the opening gets narrowed. And then also, second component of asthma is inflammation and also extra mucus production. Again, the symptoms of asthma are wheezing, or the whistling sound that you hear. And then, of course, you're short of breath. You'll have a chest tightness, coughing, either dry or productive, and because of trouble breathing, you'll have also trouble sleeping at night. Triggers of asthma includes allergens such as pollen, mold, or pet dander or dust mite. Pet dander are actually microscopic flecks from animals such as dog, cat, rodents, even birds, that can trigger an allergic reaction or asthma attack. Another trigger is cold weather, dust, or acid reflux, also known as gastroesophageal reflux disease, chemical fumes or air pollution, smoking, and this includes also vaping, stress like anxiety, mostly anxiety, and irritants like strong odors from perfumes or cleaning solutions, and then also medication such as aspirin, beta blockers, or NSAIDs like naproxen, ibuprofen. And then infection like sinusitis, colds, and flu, and moderate to severe exercise can trigger asthma. Also, food preservatives with sulfites, which is found in shrimps, pickles, beer, wine, dried fruits, and bottled lemon and lime juices. Risk factors: having a blood relative with asthma, such as your parent or sibling, meaning your brothers or sisters, having another allergic condition such as atopic dermatitis, which causes red itchy skin, or hay fever, which causes runny nose, congestion, and itchy eyes. Of course, being overweight, being a smoker, and exposure to secondhand smoke, or exposure to fumes and other types of pollution. And lastly, exposure to occupational triggers such as chemicals used in farming, hairdressing, and manufacturing. Okay, the classifications of asthma include first one is mild intermittent, which have a mild symptoms up to 2 days or a week or 2 nights a month. Second one is mild persistent, symptoms greater than 2 days per week, but no more than once in a single day. And then moderate persistent, symptoms once a day and more than 1 night a week. And lastly, the severe persistent is symptoms throughout the day and frequently at night. Depending on your classification, your doctor usually starts from just albuterol as needed for mild asthma attack, but once your classification goes up and becomes severe or severe persistent, they keep adding new medication until your asthma is controlled. So you need to follow with your doctor or a pulmonologist or allergy specialist if your asthma is in the moderate to severe persistent. Medications we use for asthma are the quick-acting bronchodilators. Example of this is albuterol, also known as Ventolin. And then the long-acting beta agonist or the long-acting albuterol, such as salmeterol and formoterol. And then the third one is the long-acting muscarinic antagonist, also known as LAMA. Example of this is tiotropium, which is Respimat, and omeclidinium, also known as Ellipta. And then the fourth one is inhaled corticosteroids. Example of this is budesonide, also known as Pulmicort, or fluticasone, known as Flovent. Inhaled corticosteroids help mostly with the inflammation so that your airways will open up. And then the new ones, there are combination medication. They add or combine the long-acting beta agonist, the LAMA, and then the inhaled corticosteroid. Example of this is Symbicort, which is a combination of inhaled corticosteroid, the budesonide, plus formoterol. And then the newer one is Trelegy Ellipta, which is a 3 medication in one. Consists of fluticasone, omeclidinium, and vilanterol. And this usually use once a day only because they're long-acting. And then the 6th treatment is leukotriene modifiers. This medication blocks leukotrienes, things in your body that trigger an asthma attack. And usually these are taken once a day. Example of this is Singular and Aculate. And then we use also steroid, either oral or IV, to decrease the inflammation of airways but usually we prescribe them for a short period of time, like 5 to 7 days, because of its long-term side effect when you use it for a long time. Lastly is biologics. If you have severe persistent asthma that doesn't respond to control other medication, then you will need biologic. They target antibodies, inflammatory molecules or cell receptors that they work to disrupt the pathway that leads to inflammation that cause asthma symptoms. Examples are in this table: the Solaire, the Fancera, the Nucala, and Singer. But once you reach this stage, you need to be managed by a pulmonologist or allergy specialist. Using your inhaler, proper way to use a meter dose inhaler is illustrated in this diagram. Of course, you first remove the cap and then make sure the inhaler is clean, especially the mouthpiece. And then you hold the inhaler upright, shake it for 5 to 10 times. The mouthpiece should be on the bottom with the top of the canister pointing up. Quickly move your inhaler up and down by pumping your forearm or wrist. But if you haven't used your inhaler for a while, you should prime it by pressing, pumping it, sprays at full force at least twice. So don't worry about wasting medication, because an unprimed inhaler will not provide you a full dose, putting your breathing at risk. Take a deep breath. Open your lungs with their maximum capacity and hold the breath for just a second, and then slightly tilt your head backward. Exhale slowly, and then place the inhaler in your mouth with the mouthpiece should sit above your tongue and between your teeth. Close your lips around it, and then press the canister while inhaling, and then count 1 to 10, and then remove the canister. Hold your breath for about 1 to 10 seconds, and then breathe slowly, and then wait a minute before you use your second dose or your puffs. But if you're using a medication that's steroid based, because usually this steroid based medication can cause secondary yeast infection, like in your mouth, called thrush. So rinsing your mouth with water will prevent this from happening. Avoid your triggers. Use air conditioner when it is hot or humid outside. Minimize the dust exposure. Of course, maintain optimal humidity. Prevent mold spores by cleaning your house. Cleaning, especially in the bathroom, kitchen. And reduce exposure to pet dander, especially if you're allergic to animals like dog and cat. Clean regularly. Cover your mouth and nose when it's very cold outside, usually in the winter time. Asthma prevention. While there's no way to prevent asthma, you and your doctor can design a step-by-step plan living with your condition and preventing asthma attack. Follow your doctor's action plan, and then, of course, get vaccinated for flu, pneumonia, and now COVID. And then you need to identify your triggers, and if you know your triggers, then avoid exposure from this. And monitor your breathing. Usually you know your warning signs of impending attack. Identify and treat attacks regularly. Take medication as prescribed by your doctor. But also, one last note, pay attention to increasing quick relief inhaler like albuterol. If you're using too much albuterol, you need to see your doctor right away to prevent complications. And lastly, stay healthy by doing regular mild exercises, maintain a healthy weight, and control your acid reflux or GERD. All right. Again, this is Dr. Dennis Latuno. Don't forget to subscribe, like, and share my channel. Thank you very much, especially to all the Filipinos, especially the OFW all over the world. Thank you for following me, and God bless, and bye.